Good morning, everyone. This is Wellness Wednesday, and today my topic is heart health. And I'm fortunate to have Dr. Ranjan, a famous cardiologist who was with the two President of India as a personal cardiologist. Welcome, Doctor.
Yeah, thank you, Mr. Gani. Yeah.
So
nice
we are very
meeting you.
fortunate. He's a person who had been into cardiology for a long, long time. So, Doctor, in short, if you can kindly talk a little bit about yourself, how long you have been in this cardiology and all.
Yeah. So I qualified in high specialty. This is my branch, cardiology, in 1985. So it's almost 35 years.
Wow.
I've been practicing cardiology, teaching my students, and it's more than 3.5 decades now.
And I met him when he was going to Mayo Clinic, and he had a heart conference back in 2003.
Yeah, exactly.
And since that time, I'm learning, and still I'm his student regarding all kinds of prevention. So, would you like to tell to our audience about what prevention should they take as far as the heart is concerned?
Normally, we talk about the risk factors for getting heart disease.
Okay.
When you talk about the risk factors, they are classified as major and minor risk factors.
Okay.
The major risk factors are the smoking, especially in young people.
Okay.
They get heart attack because of smoking,
Mm-hmm.
high blood pressure,
Okay.
and then high cholesterol,
Mm-hmm.
obesity,
Okay.
and then sedentary life, and some other minor risk factors. They can also cause heart disease. But we need to understand that any disease, the expression is usually from the genes, the genetic expression.
Okay. When you say gene, are you talking about hereditary?
Yeah.
Okay.
Maybe that your parents or your grandparents or somebody in your family tree would have got the disease, and that can express itself in the old age.
Okay.
And when you have with all these risk factors, then probably the expression is much earlier.
Okay.
So now there are a lot of studies, about the epigenetics, how you can modify the genetic expression.
What is epigenetic?
Epigenetic is a study about the genes where they are influenced by your diet, your personal habits, and all those things where, the gene expression can be, avoided or delayed.
Okay.
And one of the most important factor for any disease is the aging process. Normally we say aging leads to disease.
Yeah.
Right. So if you are able to postpone the aging process of different organs, then probably you can avoid all these so-called the deadly diseases, maybe heart attack or cancer. You can postpone it, or in your lifetime it may not express itself. So healthy heart, it's that's a slogan now.
Yeah.
But unfortunately there is a lot of youngsters are getting into health problem, heart diseases.
Okay.
And the first the killer disease
In the world is
in the
heart.
world is heart.
Okay.
So more and more we are worried about young people getting into heart attack. So definitely though they can be prevented
Mm-hmm.
getting a heart disease. And even though we talk about the preventing heart disease, when it comes to question of how effectively we can prevent, we may not be 100% sure how we can totally prevent heart disease. And normally we talk about when you talk about the prevention, as I said, the major risk factors, they have to be addressed too.
And that is, you said, smoking,
Yeah.
and then sedentary lifestyle, obesity,
high cholesterol, high blood pressure, diabetes.
and
Yeah.
all. And so a person should be going for a regular checkup once a year in order to see they are all right or not.
I would advise, a person above the age of 40,
Okay.
that's why the large percentage of, people, young people getting into heart problems is between 40 and 50 or maybe 60.
Okay.
So we normally advise them to go for a checkup on a yearly basis.
On a yearly basis.
And maybe people with high stress, we have to screen them.
And today's world, everybody is in high stress.
Yeah, high stress.
Job wise.
Yeah, even otherwise, the stress is a major killer.
Major killer.
So you need to manage that.
Okay.
And there is no medicine which can, modify your stress level. Yeah, stress level.
He or she reduces the stress.
It's only by the other means. And when you talk about the medicines to control the preventing heart disease, there is nothing much.
There's nothing
much.
What about, I've heard, there are supplements, there are natural, food by which it kinds of reduces the risk factor.
Yeah, you can think of the nutrition. Every cell in the body requires proper nutrition, right? And heart also requires proper nutrition. So now the concept is nutrition as medicine. Nutrition as medicine or food as medicine.
Okay.
And if a person is able to sort of control his the diet, in the sense, good diet, healthy diet, and also get good nutrition.
Okay.
Then probably, he can avoid not only heart disease, but he can protect his body on the whole. And apart from that, there are some herbs which can take care of the heart. And in our textbook of cardiology, there is a mention about the herbal and non-herbal supplements, and things like how the complementary or alternative medicine can help heart patients, like yoga, meditation, acupuncture, all those things. And we call that as a comprehensive therapy.
Okay.
Any patient who is undergoing especially allopathic treatment for any ailment, we can also help him out with holistic medicine, including the various forms of the alternative medicine. So in that area, I think the nutrition part plays a major role.
Any particular herbal supplement that you would like to mention? Because I did remember from your book of cardiology, you took out one page where they spoke about certain herbs.
For the nutrition part, we talk about the spirulina, where the spirulina has many nutrients, micronutrients. So that is good for the heart. And the second herb is that Ganoderma lucidum, or the red mushroom, which is good for the heart, and you can advise people taking for prevention of heart disease. Basically, it has two powerful actions on the body. One is called as the ACE inhibiting effect. It reduces the workload on the heart.
What does ACE mean?
Angiotensin converting enzyme inhibitors. So we give drugs. They act on the ACE inhibition. All the pills, a lot of drugs, many drugs like lisinopril, perindopril.
So these are all medicine.
ACE inhibitors.
And this inside the Ganoderma, you have that.
Yeah, this action is specifically the Ganoderma has ACE inhibiting effect, and this ACE inhibition leads to the reduction of workload on the heart. So when the heart is stressless, then it is protected. It functions better. We call it as afterload reduction. And the second action of Ganoderma on the heart is that it increases the microcirculation.
Microcirculation.
Microcirculation is very critical for any organ. because they only through the microcirculation the oxygen, nutrition has to be transferred to every cell in the body.
Okay.
Unfortunately, we don't have drugs to act on the microcirculation. So in my personal opinion, this Ganoderma can help in microcirculation, not only the heart but also the other vital organs. So these are the two powerful actions of Ganoderma on the heart, which are very, very powerful and important actions of Ganoderma.
Right. So I just would like to recap over here what Dr. Ranjan has explained. When a person is having a problem, of course they have to go to the doctor, get the medicine, but at the same time they should be supplementing it with two of the herbs or a natural food called spirulina, which is a blue-green algae, and which you mentioned is dense with nutrition, right?
Micronutrition meaning vitamins, minerals and trace elements.
Yeah. And which we are not getting
from
it from
our food. Normally we are supposed to get it from our vegetables and fruits.
Yeah.
But now everything is contaminated with the,
they are not organic. They are all inorganic.
And pesticides and chemicals.
Yes. All that is affecting our body, especially the heart. And the second what he mentioned is the Ganoderma lucidum, which is also called reishi, and it has got that powerful ACE inhibiting effect, right? Yeah. And which is needed, and it does the microcirculation also that you mentioned. So all that is needed now. It is the need of the hour, and if you have any questions, you are most welcome to write in the comment box or can PM me. I have been myself with the recommendation of Dr. Ranjan and so many other doctors. I have been myself using it.
One thing I would like to add, Mr. Gani, that we talk about walking is the best medicine, right?
Yes.
When you walk, your output from the heart, the blood, what the heart ejects, is going to be more.
All right.
To every organ.
All right.
More blood means more nutrition, more oxygen. The heart also requires more blood and more nutrition and the oxygen.
Right.
So now we insist on regular walking, at least 45 minutes every day.
Every day. How many days in a week?
Maybe 4 days.
4 days.
4 to 5 days. That's the recommendation of the American Heart Association. So walking is the best medicine. But how many people do it? We don't know, because now we are glued to the table with computers and your cell phones, and literally we don't walk, and we always advise from the childhood to play, to walk. And how many children are they go to the playground or they take sports or whatever.
iPad and laptop, television, or PlayStations.
Yeah.
I mean,
so that's a bad culture which is developing, which can harm the present and the future generation. So as parents, we should encourage our children to play.
Get
out of the house. Get out of the house
and play outside.
Do cycling or swimming or whatever it is. That's good for not only for the heart, for the entire body health.
So that's another very important advice from doctor, saying that we have to get out of the house, stop watching too much of TV and all kinds of gadgets that we have. And this is a very important advice, not only for us who are adults and senior, but only for the children too.
Especially for the children.
And I remember you have been mentioning that now you are seeing young adults at the age of 26, 27 getting heart attack.
My youngest patient was 22 years.
Wow. So you see,
so you can afford to get a heart attack at the age of 20 years. Say after 60, 65 it is fine. And we can do a lot of things to help the patient. We can do angioplasty, stenting, bypass surgery, and also I have seen patients having heart transplant and living for 10-15 years.
All right.
So that's we know that it's a costly affair, but still those who can afford, they can go for a heart transplant. Now the success rate is becoming a little higher. So But my opinion is, you should not end up with a heart transplant.
I mean, lot is in our hand,
Yeah.
and whatever has to happen, like you talk about genetics and all that,
Yeah.
that we cannot control, but we can.
Yeah. But the expression definitely can be controlled
Okay.
with our food and diet and regular good habits and healthy diet.
Right. So thank you so much, Dr. Ranjan, for this valuable information.
Yeah.
And I'm sure all those audience who are watching us, you'll be benefited. This is something that we should take care. Heart is the number one killer. So 70% it is in your hand, right?
Yeah.
So that's all for
thank
today.
you, Mr. Gani.
Thank you so much for this valuable information, and I wish you good health. And remember, my motto is, that is, you should be healthy and you should avoid medicine as much as possible. So good health without medicine. Thank you and good morning.
Good morning.